Public health is the practice of disease prevention and promotion of health in a general population, incorporating the various fields of epidemiology, community health, substance abuse, education and promotion, as well as management and administration. Public health mainly focuses on threats to health based on population health analysis. Community health, being encapsulated within the field of public health, focuses on protecting and improving the health of a specific community or geographical location by means of education and healthy lifestyle promotion. The primary functions of community and public health departments are health assessment and monitoring, policy inception, and assurance to access of health care. Our public health departments exist to provide a variety of programs that encompass a plethora of health-related issues, including environmental health concerns, infectious disease treatment, vaccinations, chronic disease, and substance abuse. U.S. health officials identified the 10 essential public health services that must be met by health departments, including monitoring, diagnosis and investigation, education, community partnerships, policy development and plans of action, laws and regulations, health services recommendations, assurance, evaluation, and research. Each state, including the District of Columbia, has a state health agency that services the public. In 55% of U.S. states, that agency is independent of the federal government. Individual states typically hold authority over public health. Federal policy may influence public health departments, but it does not dictate their individual practices, though some requirements may be defined due to grant funding. Certain agencies will focus entirely on public health, while others extend their reach to include programs such as Medicaid. 45% of states include the functions of social services, long-term care, insurance, and the traditional public health roles. 29 states, or 58%, have a decentralized model of public health, meaning their agencies are independent of the state and run by local authorities. 6 states, 12%, operate centralized agencies, being directly governed by the state. 13 states, or 20%, are under a hybrid model. Their public health departments are state and locally run. Only 2 states, Hawaii and Rhode Island, have no local health agency and rely solely on the state to provide public health services. Regardless of government entity operating the health agency, there is a responsibility to provide public health services to the community. The law can influence public health in various ways. Legislation can provide funding for public health services that must adhere to specific guidelines, or it can inflict restraints on how money can be spent. Other regulations can assign and specify responsibilities related to public health emergencies. For instance, each state has passed legislation allowing for quarantine and/or isolation to prevent the spreading of an infectious disease. Public health law creates an environment for people to live healthier, safer lives in a way that identifies and responds to threats, sets and enforces standards, and uses influence to create a new normal in healthy behaviors. Ethical aspects of public health are only beginning to draw attention. At the Association of School of Public Health, courses have been designed around the traditional values of public health, as well as ethical issues stemming from infectious disease, environmental health, and healthcare reform. The area of ethics in public health looks to understand the concepts that guide public health actions. The main concern with the ethical dimensions of public health are professionalism and moral trust. Trust that our society puts into our healthcare professionals as representatives of community health. There is no current official code of ethics in this field, but providing a strict set of guidelines could help to resolve any future ethical dilemmas. Unofficially, there are a set of values that have been set forth by the Public Health Leadership Society. Public health agencies receive funding primarily by the discretionary budget authority through the annual appropriations process. The monies granted to these agencies come from various government departments, including the Departments of Health and Human Services, Education, Interior, Environment, and other related agencies by way of the Appropriations Act. Certain mandatory funding is also provided to specific programs and activities under the umbrella of public health. With the implementation of the Affordable Care Act, further appropriations provided billions of dollars in spending to support new or existing programs and activities. One of these being the Prevention and Public Health Fund. The HCA provides permanent annual appropriations to support prevention, wellness, and public health programs and activities. Communication is what we do as human beings. In the realm of public health, sharing information is essential. Communicating information on health issues and services is a key aspect to disease prevention and control. Those working in the public health field can share critical information with each other and with patients about community health risks, public health messages, campaigns, websites, personal care systems, and individual health tools. Communication on the academic side of public health is important for research, teaching, training, and practice. Applying communication techniques to public health is the best way to bring a plan of action to the forefront.